Okay, hi everyone. Good morning, good afternoon. My name is Dr. Heather White, and I'm the Executive Director at Together for Health. I'm very pleased to welcome you all today to our webinar entitled Excerpts from Enough: Conversations with Cervical Cancer Survivors. This is a bit of a different forum for us, and I couldn't be more honored and excited to share the stage and really hand over the stage to today's panelists. But before we begin, just a few housekeeping notes. We will keep all of our attendees on mute. Following our conversation, we'll have about 15 or 20 minutes for questions to our panelists. If you have a question for someone, please do write it in the chat box, and we'll do all our best to get to all of the questions. You may write your question at any time, and we will work through those in the queue. This webinar is being recorded and will be available on our website after the event, and will be sent to all folks who've registered for the webinar today. And you can also send us any questions or follow-up. We always love to hear from you, particularly around any topics that you are interested in us presenting on. We'd love to hear from you. And now with that, let's get started. I would like to introduce our moderator for today, Miss Eve McDavid. Eve is a cervical cancer survivor, and like our other panelists, her story is featured in the book we're discussing today, entitled Enough: Because We Can Eliminate Cervical Cancer. Eve is the CEO of Mission Driven Tech, a women's health company with a mission to eradicate cervical cancer by building inclusive products for people with a cervix and the providers who treat them. And with that, I'd like to hand it over to you, Eve. Thank you.
Heather, thank you so much for the introduction. It's a pleasure to be here and to host this important conversation. First, we'll begin by introducing our panelists. So I'd like to start by first introducing Dr. Linda Eckert, a board-certified obstetrician and gynecologist and an internationally recognized expert in immunizations and cervical cancer prevention. Dr. Eckert is the author of Enough: Because We Can Stop Cervical Cancer, which highlights her own experience treating cervical disease in the US and globally, alongside the stories of cervical cancer survivors who have themselves become cervical cancer advocates and champions for change. Linda, welcome.
Thank you so much. It's such a pleasure.
It's great to see you. Okay, next I'd like to introduce and welcome our panel of incredible women. Let's start by welcoming Ms. Carol Lacey, who is based in California and is a proud mother, survivor, and cervical cancer ambassador. In this role, Carol works closely with a global nonprofit organization called Survivor, with a C, which aims to bring the collective wisdom of cervical cancer survivors together to create a community of advocates. Carol, welcome.
Thank you. It's so great to be here. Thank you, Eve.
Great to see you. Okay, next I'd like to welcome Ms. Carla Chavez, a cervical cancer survivor and ambassador from Honduras. Carla is a civil engineer and amigurumi enthusiast. Yeah, okay, I was she too is a very active member of Survivors Global Network as an ambassador, a 2019 Survivor School graduate, and co-leader of the Survivor Espanol community. Carla, welcome.
Hola, Eve. Hi, I'm happy to be here.
Great to have you. Okay, and now I'd like to welcome Ms. Karen Nakawala, a cervical cancer survivor and founder of Teal Sisters, a global nonprofit created to advocate for the reduction of cervical cancer mortality and morbidity, as well as the improvement of sexual and reproductive health for both girls and women. Karen is based in Zambia, where she is very much in the public eye as the host of a popular weekly radio program, a television talk show, a magazine, among other activities. Welcome, Karen, and thank you so much for being here.
Hi, Eve. It's so good to see you.
It's good to see you. I must say, and I'll jump into questions, but it's a small but very, very powerful community. And all of us have been together either recently or, you know, a little bit, a little bit of time has passed since we've all been together, but it's just wonderful for us to all be together now and present to have this really important conversation today. So Linda, I'd like to start with questions for you. Would you start by sharing with us why you decided to write the book Enough?
Thank you. And I'll try to keep it simple. I could talk a long time about that. But for me personally, I have over 30 years of care for women as an obstetrician gynecologist. And I actually had my first encounter with cervical cancer patients when I was working in Liberia when I was 25, pretty wet behind the ears, a brand new, well, not even a medical school graduate. I was in my fourth year of medical school. And I was struck by the fact that we couldn't do anything for this patient, nor did Liberia have treatment for any other people with cervical cancer, nor did most of the world actually have screening or treatment. And so right away, this was in 1987, I had this indelible mark on my heart of, gosh, what a thing that is just killing women, and what can we do about it? And when I went on to finish my training back in the United States and then worked more in the United States or globally, I continued to encounter patients and still do at least twice a week or twice a month at the hospital where I work in Seattle who have advanced cervical cancer. But during my career, we've also developed the HPV vaccine. We've gotten better screening. We have ways to not have this happen to women. And it just essentially it was breaking my heart to continue to tell women that they had this cancer that I knew was preventable. And I became convinced that stories have power and information have power. And we need to have the stories of the people who've been struck by this disease out there, together with information that's very approachable, that is understandable, it's not science jargon, so that we can help paint a picture of why this is a preventable cancer, and mostly so we can learn what we can do about it.
Linda, that's incredibly powerful and so important. Thank you. Could you talk a little bit about how your approach, both as a practicing physician and a woman, give you a unique lens in your approach to this global crisis, and then, of course, how you wrote the book?
Well, thank you. As an obstetrician gynecologist, I am a fierce believer in the power of women and
Mm.
their strength and just what it takes to live their daily lives, to do all the service work they do, the care they offer, birth babies. There's nothing that will give you respect like watching women birth babies. And I just felt that as a believer in this power of women and watching women my whole career, what could I do to try to help prevent their deaths? We need them in our culture. They are the bedrock of every organization, of all their families. We know what happens when you lose a mother to children, how they don't do well, they don't finish college, they don't get their vaccines, they marry early. And here we have this preventable illness. And so as a physician who's tried to focus my career on preventing illness, I thought, gosh, this is this is a cancer we can prevent. And so what can I do? And I got this crazy idea to write this book. And, this is not something I've done before. And my career's been more in the academic realm, in the guideline realm, in the publishing papers and giving grand rounds realm. And this is really a new adventure for me.
Mhm. Well, one that was ready for you. So we're all glad that you chose to lead here. Um, how did you come to meet the women who are featured in your book, Dr. Eckert?
Um, well, I, have worked in this space for a long time. I've worked with the World Health Organization and other global organizations, and I have done work in the US extensively. So I felt like, oh, I have some contacts I can use, but then COVID hit. And so I'd taken 2020 off to write this book. And all of a sudden I couldn't travel to the places that I needed to do, et cetera. So fortunately, through Zoom, I was able to connect with individuals through survivor organizations, either based in the US or globally, Through the World Health Organization, I got some contacts as they were launching their cervical cancer elimination. And through essentially just having worked and known the space, I also established a website. I reached out on Facebook, etc., and invited people who felt comfortable sharing their stories with me, knowing that it could end up in a book, to contact me. And then if they contacted me, that was a way of their offering their permission to talk about it. We could have a conversation. And I was just so fortunate to meet the people I've met from all over the world, from 6 continents, who gave stories for this book. Women will do anything to help other people not suffer the same disease, as you all know.
Yeah, yeah, that's incredible. And I think what you just described there around the rise in access to identifying women all over the world who've been touched by cervical cancer. This is a very isolating and lonely diagnosis. And to find other women and be able to connect in that capacity, that's what takes away the shame and a lot of the trauma that goes along with the diagnosis. So it's just incredible that this challenge also then became this opportunity to meet so many incredible women who are featured in your book. Thank you so much.
Thank you.
Mhm. Okay, so my next set of questions is now for Karen. Karen, I am, first of all, I'm very excited to see you again. And I would like to ask you, what would you like to share about your personal story with cervical cancer?
I think the first thing that comes to my mind, Eve, is what happened when I got the diagnosis.
Mm.
The first thing that went through my mind was I was going to die, and it's not something that you'd wish on anybody, really. I have 2 girls, and I wasn't married at the time. My partner and I had just gotten back together, and I struggled with how am I going to tell them that I'm going to die. It wasn't about telling them that I had this disease. It was about telling them I'm going to die. So you guys, going to have to find a way to go ahead without me. And I think that was the most horrible feeling ever. I think if there's anything that I remember so vividly, it was that feeling, because I just never forget about it. I remember for 3 days straight, I never slept. I saw the sun rise, I saw the sun set. And it took everything in me to sit my children down and tell them that this is what it is, this is what I have. And obviously, I think I probably underestimated them. I thought they were going to break together with me, but they became my strongest support system. And I think it was because of them. If they probably had reacted in the way I expected them to react, I don't think I would have survived it. But I think they were so positive. Even in their brokenness, they showed me a lot of strength. I didn't know about the HPV vaccine. My 9-year-old then is the one who told me about the HPV vaccine. So I think my journey was the journey of discovery. Like I said, I didn't know about the HPV vaccine. I started learning a lot about cervical cancer, and suddenly I think I started meeting women that were affected because we were together during treatment. We lost some survived, and some have gone on to survive, like myself, and some have unfortunately either had a recurrence and died, or are going through their phase of treatment. So the fact that I thought I was going to die, I always talk about it, because even now I think I always cry when I think about that. So I'm just so grateful to be alive.
Karen, thank you so much for sharing with us. I hope it's okay that I say I deeply empathize with what you just shared. And I also think it's so beautiful how your family filled in for you in these ways that we get broken down by this diagnosis, to see the hope and the strength in our families when we ourselves can't summon that. It's a beautiful phenomenon, and I can appreciate how it can help give us hope when it's very, very hard to find. Yeah. Karen, you are quite a incredible person, and you are the leader of an organization called Teal Sisters. Can you share more about how you decided to become an advocate and then launched Teal Sisters as part of your movement?
I think when I started Still Sisters, that was after treatment. You know, I think it was a couple of maybe 4 months after my treatment. And the reason I started was because I thought there wasn't enough information out there. Because for a person like me, I'd like to believe I'm in a privileged position where I should have all this information, but I hardly knew anything about cervical cancer. And so I thought, if a person like me, who is on radio, who is on TV, doesn't know much about cervical cancer, what about that woman who's sitting in the village who can't even afford data to be on the internet, who can't even afford to buy herself a newspaper? What is going on with them? And so that is how I started. Initially, it was just a Facebook movement, which by the end of 1 month, we had over 130,000 women on the page. And after that, I thought, you know what? Let's move away from Facebook, because I think the women that need this more are the women that cannot afford to be on social media. And that is how we registered it as a foundation. That is me and my partner then, who eventually became my husband. And that is how we started Till Sisters. But when I look back, I actually started Till Sisters to help me with my healing journey. I think there is nothing as powerful as meeting women that you are sharing the same experience with. And you share your highs, you share the lows. And it was just amazing what that did for me. And I realized that I was one of the lucky few, especially in Africa, where most countries don't have treatment. But I was lucky that from diagnosis to start of treatment, it took me 3 weeks. We've got women right now who are waiting 2 years to get on treatment.
Yeah.
And so I considered myself really lucky. And I think that was the other reason I thought, you know what, this is a preventable cancer. Okay. So if we can prevent it, why should we let women die needlessly? And especially if we have the tools, if we have the know-how, why should we have a woman dying every second minute? I think that is unacceptable. It doesn't matter which part of the world you come from. And so I thought I'll be able to share information about how we can prevent cervical cancer. I thought I'd share information about how it is treatable if it is caught early. And I thought I would share information about the HPV vaccine and how just a change in lifestyle can help as a preventive tool. And so I think that is what Till Sisters has been about for me, really. It's just about empowering the women out there, having them take charge of their own health, their own sexuality, because at the end of the day, that's what it is. Take advantage of the fact that everything is in your hands. You know, I always say that life is like a remote control. When you pick it, you want to press this channel, you want to stop, press stop, you want to increase the volume, you want to be happy. That is what life is for me. And I think that's what Till Sisters has been about.
Karen, that is beautiful. And I'm just writing down life is a remote control because I'm going to use that. But credit to you. Credit to you. Karen, what you just described there, first of all, congratulations and thank you. You've described one of, I think, the most promising themes in this movement, which is that there is not nearly enough information that is shared or communicated to all of us, you know, no matter where we are. There's a real dearth of information. And then when the diagnosis touches one of us and we understand the weight and the want, this like deep carnal feeling that I don't want another woman to have to go through this injustice. That is such a galvanizing force. And I think what you just described around, you promoted a group for a month and had 100,000 women show up. That demonstrates the hunger and the appetite for what can we do about this. This is a binary experience. When you learn what can be done and when you learn how it can be prevented, there's no going back. It's impossible to ignore. So Karen, you just touched on some really, really incredible like tenets of advocacy in cervical cancer elimination. And I'm so grateful for the incredible work that you're leading. Thank you. Is there anything else that you would like to share about Teal Sisters and the work that you do? And you know, what makes you most proud, Karen, of all the incredible work that you're doing here?
I think what makes me proud are the small achievements that we make every day. The other day I was having coffee. I think 3 days ago I was having coffee with a friend, and these two ladies woke up to me, and it's like I heard them say, "She's the one." They said, "Are you sure?" "Yes." And then they came up to me and said, "Hi, Karen." I'm like, "Hi." And this one says to me, "You have no idea what Till Sisters have done for me. I had literally given up because I'm a cervical cancer patient and I'm going through treatment. And I had given up so much. And I thought the best thing for me was just to die." And she gave me this hug. I'm sorry. I'm so sorry.
Oh, please.
I'm so sorry. And then she says, every time I've got a group, apart from the Till Sisters big group, I've got a survivors group. And I've got about 80 women in there. So some of them have gone through treatment. Some of them are going through treatment.
Mm-hmm.
And so every day we just try to talk to each other, you know. And she says, every morning when you wake up, the first thing, and you ask each one of us how we are, if there's anything that you want to talk about, that just gives me hope, you know, because there's so many women there that come up and say, I was so alone. I was prepared to die in shame and alone. But there's still sisters. And I know that I've got a family of sisters that I can depend on. And so it's small things like this. Forget the big things, you know, but it's small things like this that just make me want to go on every single day.
Yeah.
It's not about helping hundreds of women, but it's just about that one woman that comes up to you and says, "Thank you very much. I got my cancer early because you spoke to me. I got through the day because you held my hand." And for me, I think those are the biggest achievements, and those happen every single day.
Karen, thank you so much for the incredible work that you do. You are a beacon of light for all of us. Thank you. Yeah, thank you so much. Okay, Carla, I now will turn the spotlight to you for our conversation. I am interested to hear, Carla, anything that you'd like to share about your cervical cancer diagnosis and how it has impacted you and your life.
Hi, Eve. Hi, everyone.
Hi.
I'm sorry, I just have to breathe in everything. I
Yes,
just have
and
to
take your
say,
time.
Karen.
No easy transitions here. This is
No, not
one
at all.
hard question after the next. So everyone take your time.
Oh, well, a little bit about my cancer diagnosis. I was diagnosed at 35 after test for thyroid cancer, which was my first diagnosis. They were totally separate cancers. When I was getting ready to take my thyroid treatment, I was diagnosed with cervical cancer about 2 months after my first diagnosis. So the doctor said, we're going to stop everything that has to do with thyroid cancer and work on cervical cancer. About my treatment and everything, like I did chemo, radiation, plenty of surgeries. I developed a rectovaginal fistula after my hysterectomy, which now has me having a colostomy. And all of this that happened during my cervical cancer diagnosis was sometimes I felt alone, because even though I had a lot of support from my family, my doctors, everyone was always, on top of me, and didn't have anyone to talk to. And I used to tell my doctor, do you know anyone that is going through this? Give them my number. I'd love to talk to someone. And he says, they don't want to talk about it. They don't want to talk about cervical cancer. They're mostly older women, and the younger just don't want anyone to know because of the stigma that exists in our culture to talk about HPV or anything below the belt. So in that period of feeling alone, I think was what motivated me to talk about my diagnosis. Even though I lead a very busy life, I I work a lot. I move around a lot because of work. I said I'm just going to use to keep talking about it. And I only work with men. Most of my team members are men, so I talk to them about cervical cancer. So that change is because I don't want anyone to go through it alone, and I don't want anyone to go through it at all. So that would be like my motivation for it.
Carla, thank you so much. And might I just express my sorrow for the isolation and loneliness that you experienced in your diagnosis. You deserved to feel part of a community, and that, as awful as it was also something common that many other women have gone through a very similar experience. I personally can empathize with that feeling of I'm the only person who's ever lived this. And we know, and through so much of Dr. Eckert's book, we know on paper that's not true.
Yeah.
So thank you for finding your voice and for rising up and refusing to believe that isolation is something that we deserve through this diagnosis. You've already shared some of the ways that you are sharing the message and influencing folks around you, especially men who are
Mhm.
in a very important part of this equation in elimination.
Yeah.
So why don't you share with us, like, how do you talk to men about cervical cancer, and what do you say to them to get them, riled up and ready to fight with us?
I have a big advantage that we hold toolbox meetings with our work crews every Monday. And this being January, CCAM, I hold one at mid January, and I tell them about my story. I don't go like, I want you to know I had cancer and I had cervical cancer. I say the words just like it is. It's
Mhm.
because of an HPV and everything. And most of them are like in shock because they see me walking around in constructions and everything. I'm like, you had cancer? Yes, and I want you to know about it. I want you to know about HPV. I want you to get your daughters vaccinated. And I tell them about the vaccine, how vaccines work in Honduras, where I live, and that they're free for girls from 9 to 12. And I tell them all the information and how they can get it also in a private sector. And I tell them to talk to their wives, to tell them to go get screened, because one of the biggest issues we have here is that we don't go to the doctor. We only go to the doctor once we're sick,
Yeah.
or
Mhm.
in more of the rural areas, they haven't even seen a doctor, only for birth.
Mhm.
So I talk to them about it, and they're receptive. I can't say this enough. I had talks at universities, and the boys and men are more receptive than women.
Yeah.
They actually want to get vaccinated because once you tell them about everything that goes on, okay, I want to do this. I want to help. So it's actually been very easy, and I've had a lot of support from my boss also, so I can talk about it every time. And I wear the pins, and so I just go on.
Carla, that's incredible. What you're describing is you're changing the culture. You're changing people's understanding of what preventative medicine is, what it's for, and one's relationship with doctors, which is incredibly important. And you're helping people get into that prevention continuum, and that is like a totally different understanding from what you've just described. Only go to the doctor once you're sick versus what can I do now so that I never have to go through this, so my family never has to go through this. Congratulations. That's just incredible. Carla, could you talk a little bit more about maybe that decision around, you went from your doctor describing this experience as one way, and no, there's no one else you could get in touch with to to feel less alone and to understand what this journey looks like, to now being a very vocal ambassador and a change agent in your country. So can you talk a little bit more about how you decided to become an advocate and what that process looked like for you?
Oh, this got me here. While I was, it has to go back to my story also. While I
Please,
was
please.
in bed after my hysterectomy, I was alone. Even, and like I said, my family supported me. Everyone was there, but you need like that voice that tells you this is going on, this is going to happen. So I went online and said, someone has to have gone through this. Someone has to know what's happening. And I found Survivor with a C. And I remember I just went through their stories and I'm like, whoa. I mean, someone is sharing. And if they're sharing, why don't I share? So I started getting to contact. That's how I went to survivor school because I wanted to be educated on a way to speak, because I would get all, emotional, sentimental when I talk about it, but sometimes the message has to come across, right? And you have to be able to speak about it. So I needed to get educated. I went to survivor school and I just don't want to shut up about it. So now that I have the tools, I feel empowered to be able to go and talk about it. So my biggest reason is that thank God for the support I get through Survivor, but being able to talk about it and make sure that no one goes through it. And if they do have to go through it, not to go through it alone. And above all, know that it is preventable. And I remember when I found out it was preventable was through Survivor. I'm like, there's a vaccine for this. I didn't know about this. I mean, I it was just like eye-opening. So I talked to everyone about the vaccine. I think it's our first form of prevention.
Marla, that's incredible. That's just incredible. And 2 points that you mentioned there that really stand out to me. Number one, practice, right? It takes time and repetition to go from
Yeah,
this is something, and it catches us, right? It's we're not immune
yeah,
to that. But to be able to tell your story with the purpose of creating change, that's an exercise in practice and in confidence building. And with this diagnosis, especially the confidence part, that part shatters first. So
yeah.
congratulations in building back through and becoming the incredible advocate and change agent you've become. Thank you so much.
Thank you, Eve.
Certainly, absolutely. Okay, so with this, I'm going to turn to our next panelist, Carol. Great to see you. How are you?
I'm well. This is
Good.
really exciting being here. Thank you.
Oh, certainly. Absolutely. Okay, wonderful. So, Carol, I'll ask you a similar question. What would you like to share about your cervical cancer diagnosis? When were you diagnosed, and anything that you can share about this experience and journey for you?
Oh, sure. I was 46, and honestly, when I thought I was going through premenopause originally, but then seeing my gynecologist, and she immediately sees a mass, and that mass ends up being cervical cancer. What I take away from my cancer is that it was very persistent. I had multiple reoccurrences. One of those reoccurrences, unfortunately, I had to undergo a total pelvic externation, which basically removes everything remaining below my belt. So like Carla, I live with a permanent colostomy and also a permanent urostomy. And then even after that, I had another reoccurrence and went through some immunotherapy and some salvage chemotherapy until I was declared no evidence of new disease in 2017. So for me, the saving grace was finding Survivor, because I knew that my story was important, because everyone, when I first talked about having cancer, there was this initial, oh, it's breast cancer, which I'm a woman and I could see that, but I thought, no, it's cervical cancer. And I would get these really kind of confused looks like, what's cervical cancer? So in finding Survivor, I realized And there's an entire community of people who've experienced such a similar, journey as mine, yet different. And, knowing that turning that pain could be something positive. We could actually help to eliminate this very, very preventable cancer. Because as Karen said, we have the tools now to just make this go away. So that's a big part of my journey and all of this yuck stuff.
That's right. All of this yuck stuff. That
Yeah,
absolutely.
can I say yuck?
Yeah, you can. Absolutely. Carol, thank you so much. And similarly, thank you for your courage. Thank you for your brightness, and for the hope that you bring to this movement. Thank you so much.
Absolutely.
You have a tattoo, if I recall, on your
Yes.
forearm that reads "More Sunny Days." Can you tell us more about the tattoo and what the phrase means to you?
Absolutely. It's very near and dear to my heart. I'm going to start crying. I had the luck of being able to know my great Aunt Anna, and she was a really wonderful woman. Anytime anyone would ask for her age, she would always say, "Honey, I stopped counting my years and I only count my sunny days." And I thought, as a teenager, I thought that's a great way to kind of sideswipe that question. But here I was going into my surgery for my total pelvic externation, and I kept hearing her voice. I kept hearing "more sunny days, more sunny days." And because, living with cancer is all about counting your sunny days. And I had to get that physically on my body so it could be an outward, mantra that I shared with everyone. And that just became me, more sunny days. So I'm so glad you asked that question. Thank you, Eve.
I'm so glad you shared. There is a specific wisdom that comes with this diagnosis.
Yeah.
And I sense part of it is because so many of us are diagnosed quite young. And we have a really interesting vantage point to understand, the meaning of life, why we're here and what we're here to do. And I'm so glad that the voice in your head that played in those dark moments was one of positivity and hope. That's an incredible lesson to all of us. And I think it helps make that hope more accessible to any of us who, sometimes I'll raise my hand, have a prickly voice playing in those hard moments. So I think you've given us all a new track to play. Thank you, Carol.
Yeah, thank you.
Absolutely, absolutely. So you found Survivor. You carried with you an unbreakable spirit. Tell us how you turned that into becoming an advocate.
Well, I think once you find out, the connection between HPV and cervical cancer, and there's an HPV vaccine, and all of that was because of Survivor, right? The education that we undergo as becoming ambassadors at Survivor School, like Carla said, we're able to realize that our cancer really can be eliminated, for, future generations. And I think about my nieces, who are 10 and 9 right now. And I think this could be a world where they don't have to ever hear you have cervical cancer. So that's what motivates me to keep, because our stories are what is going to put a face to cervical cancer. And I think, as survivors, we know that sharing our story is what is going to motivate people to vaccinate their children. It's going to get them to go to their, cervical cancer screenings. And so that's what we are doing, to break down those barriers and those stigmas. So I'm glad you asked me that.
Incredible. Thank you so much. I think, Carol, you just described a really, sort of similar driving force that Carla and Karen also described, and Dr. Eckert, this is all over your book. A survivor becomes an advocate because she understands that this is preventable and wishes no one else to ever experience this type of pain. And that, I think, is so incredibly empowering and uniting about this movement, is that there's this ferocity in changing the opportunities for the next generation. So thank you so much. Carol, is there anything else that you would like the world to know about your experience with cervical cancer or what this movement means to you?
Well, I think Karen put it so well, is that, since we do have these tools to eliminate cervical cancer, what we need to do as a society is make sure that everyone has access to those tools, right? That they're armed with the knowledge to take care of their cervical health. Having conversations like this is such a great start. And, organizations like Survivor who, are actively kind of changing that narrative of the patient voice and elevating that patient voice. That's really what's going to make the change.
I agree. Thank you so much, Carol. Thank you.
Thank you.
Okay, wonderful. So I think Tom is up with a question for the panel. Is that right? Excellent.
That's right. So the first question for our panelists is actually for you, Dr. Eckert. I just wonder if you could speak a little bit about sort of what are your hopes now that the book is its own entity. What do you hope is the journey for the book and the stories therein? And also, if we can, and I'll say we can provide information about where people can find the book, but also please do put it in the chat for folks on the webinar today.
Well, thank you so much. And, as you've heard right now, my journey for this book has been profound. All of you have changed me. But I hope everyone reads it. And the reason I hope everyone reads it is because I do think people this is too well of a kept secret. And there's too much stigma. Breast cancer used to be a cancer nobody talked about. Let's make cervical cancer the same as breast cancer. Let's say cervix. Let's say vagina. Let's talk about HPV. Let's talk about a preventable cancer in language that is not stigmatizing or off-putting or people are comfortable with. And we have a long way to go with that, especially in some cultures, as Carla was speaking so eloquently to, that this is not a topic that gets addressed. So I hope this book becomes just another tool to take down stigma, to help people understand what HPV is, how to talk about it, what language might be useful. There's certainly wonderful examples of you and 30 women stories, as well as stories from my own career. There's also a list of resources that people can choose to use. There's examples of how to do different types of advocacy. You don't have to write a book or start a movement. It's, how do you talk to somebody on the soccer field? How do you use and get comfortable with language? So I do hope that the book can become a book club book, can become shared easily, that becomes part of parent-teacher associations, school nurses, and I hope it'll get translated. I hope it'll get translated into Spanish and French. Cambridge University Press is very open to that. And I think, again, that translation and information would also be another way to have, that is one of my hopes for this book. As far as how to find it, you can find it from your common bookseller. Certainly there's online booksellers, but another good way is to go to a bookstore and ask them to order it for you, because then they see it and you can tell them why you want it. And I think that, putting a book like this out there is going to be a grassroots movement. Just like advocacy, a lot of advocacy You know, yes, I have a publisher and I'm proud of my publisher, but truthfully, it's word of mouth, it's sharing about it, it's talking to people about it that will help it get read and help it get into the hands of the general public, which is who I wrote this book for.
Thank you. That's fantastic. And I have to say, you know, having read the book, I learned so much. I think even working in this space for quite a long time, I think I had this very sort of simplistic view of what it meant to be a survivor, and to hear the nuance and the weight and frankly the hope of all of your stories made me realize that even as an advocate and somebody who speaks publicly about this work, it is, you know, my job is to really cede the floor to you all, because you live it, and you can be the voices and the lived experience that I think touch people in ways that that need to happen. It does feel to me that we are in, I hope, an inflection point around this issue, and that we have the ability to hold hands. And Carla, your conversation about speaking to anybody who will listen, but particularly men, I think is so key too, to getting outside of our own comfort zones about what it means to talk about this disease, and to use anatomically correct, non-stigmatizing language, which is easier said than done, even for people like us who live and work in healthcare, public health, and medicine. So I just applaud each of you in your own way for what you're doing on a daily basis to talk about this space. I'll share a particular vignette, which is where I live in Alabama. We have a project called Operation Wipeout, which several of us came together and put together on our own, because we really felt like we had, after 20 plus years in our respective institutions, we had, you know, a large Rolodex, each of us, we could start to call on colleagues, peers, et cetera, and to say, you know, let's join forces. And our work really is about activating and educating entire communities and saying it's not about us. It really is, this is in the hands of everybody in our state. And so we take what we call a conga line approach to partnership, which means you can join the conga line and you can have any style of dance you wish, but you better keep moving, because if you stop, the conga line stops. So it's like, bring your energy, bring your fight, you know, come to the table with us. So in any case, I'll stop there. We've still got a few more minutes. So Eve, I don't know if you have another question for the panelists. I've got a few more questions in my back pocket if not, but
Yes.
yeah, please.
Yeah, absolutely. And Heather, that was excellent. What you just described is the enormous cross-functional effort that elimination requires. And I see it also as an opportunity, right? There's so many different fields that are connected to this. There's public health, there's oncology, there's sexual health, there's women's health. And those are just like the fields of medicine, not to mention all the professionals and everyday people that interchange and exchange with that continuum. And so success here looks like successful community-wide efforts. And I think it's incredible how you have described that and brought so many people in to work together on a shared goal with a shared objective, all coming together. It's fantastic.
I have to say, one of the little dreams I didn't talk about for this book is, you know, I teach public health courses. I would love this book to be part of a global health undergrad or master's in public health curriculum, because it has so many case studies and it talks about vaccine access and health economics and cost effectiveness in a way that's approachable. And, you know, reading books like this certainly motivated me and formulated my career. So that would be a secret dream of mine, is, you know, getting into more of the university space as well.
Dr. Eckert, thank you. Okay, I see one more question about Survivor. So how can people find out more about Survivor and become part of this network? And then I'll
I think-
ask the same thing about Teal Sisters as well, Karen.
And Carla and I can share this one, but you can definitely go to our website, and it's cervivor.org, and you can find us on any social media platform: Instagram, Facebook, Twitter, X, LinkedIn. We're everywhere that you get your social media too. And we do have a private Facebook group for cervical cancer patients and survivors on Facebook. It's I'm a Survivor with an exclamation point too. Did I miss anything, Carla? You have Survivor Espanol. We also have other groups within our community that specialize communities of color. We have LGBTQIA plus groups. So we are very inclusive in getting all of the patients and survivors out there connected to Survivor.
Carol, thank you. And then Dr. Eckert, we have included in the chat more information about where to find your book. And then Karen, if you would, please share more about how women can get connected to, and allies can get connected to Teal Sisters.
Thank you so much, Eve. So you can get us on our website. It's www.tealsistersfoundationzambia.co.za, and also on Facebook, Teal Sisters Zambia on Facebook. We're also on Instagram and Twitter as well.
Excellent.
That's fantastic. And I will say we will be sure to put contact information for each of your organizations in the emails that go out to everyone who's registered for the panel today. So if you're fast and furiously writing, no need. We can make sure that you're connected to each of the organizations. I just have one final question for each of you, and it's one that keeps me up at night, and I'm sure it does for you all as well, which is to say, this past week, several of us had an opportunity to be at the White House to talk about advances and progress, but also gaps and challenges, both in the global fight and the domestic fight in this disease. And Eve, who of course is moderating today, made a terrific statement, which really stuck with me, which is, let this be the day that we turn from the vision of cervical cancer elimination to the action of cervical cancer elimination. And how do we really make that pivot? How do we make that transition? You all do this in your work every day, but I would just love to hear some reflections about not only what we on the line can do, but what everyone can do to really make this an issue that we take from a vision to an action. And so maybe actually I'll start with you, Eve. I'll put you on the spot.
And thank you for putting me on the spot. Thank you, Heather. And thank you for so kindly describing the event last week at the White House. And it was my greatest honor to have the microphone. And I will say I have been ready for that moment. I think about this through the lens of my career prior to my own diagnosis, and then moving into women's health, into cervical cancer innovation, which is to say that I mentioned earlier, everyone who works in this field comes to the exact same conclusions. You know, you see it at a one-to-one level, you see it at a 30,000-foot view, and it's the same challenges with misinformation or lack of education, with shame and stigma, and then a fundamental access to care or quality care that really breaks down this entire care continuum that otherwise might run smoothly and make elimination possible. If that entire care continuum were an industry in the private sector, and there was a CEO of that industry of cervical cancer elimination, and that CEO got a report of what had been happening in this field for the last 50 years, despite the incredible medical and scientific breakthroughs. That leader would say that this is not working, and it is disgraceful what's happening, that women are subject to dying from diagnoses in their 30s and 40s from a preventable cancer and devastating their families and communities and society from both a social and economic standpoint. I mean, it's just unconscionable. And so my message to change this from vision to action is to have our leaders step up. There needs to be leaders in charge of this movement who have ownership and accountability. And what does that take? It takes investment, it takes research, and it takes innovation. The tools exist, and they have now existed in the current state for 20 years. I think the vaccine is the most recent introduction of new technology into the field in 2006. So the tools exist, but the will and the want and the investment required to actually change things, that's where our leaders have to step up. And so that was my message last week. I want to see global ownership over this and accountability. And when we put that in place and we start tracking what are our investments and what are the outcomes of that, how do we start to change that curve? I believe that's how this field starts to change. But we have the passion. Everyone on this group represents a unique vantage point and geographically, a catalyst for change. So that part has been strengthened, I think, in large part, Dr. Eckert, because of your book, because how you've described and organized the industry and everyone who's fighting for this. And now it's time for our leaders to embrace this as an incredible opportunity for the future health of our planet.
Thank you, Eve. I couldn't agree more, and I think you said it very eloquently. It is time for leaders to step up, and that's a big part of the work that we do at Together for Health. We have just a couple of minutes, and so I'll invite any more reflections from the panel on how we move from the dream to the reality of cervical cancer elimination. So anybody who'd like to chime in.
I actually, I feel passionately about everything you said, Eve, and I also feel passionately in the power of grassroots movement. If I look at how so much change has happened, for instance, on HIV policy in this country, it was a grassroots movement. It did not start from the top. It started from the bottom, from the people impacted by it. And so I do feel like we can embrace our power and talk more and align. And I feel hopeful about that. We have a lot of work to do in the infrastructure of healthcare to truly get access to everybody in this country. But until we really start talking about it in an honest way, and I was encouraged that the White House had some really honest conversations, then I think knowing the problem and figuring out how to address it is one thing, but also helping all of us to say enough. I mean, that's why I titled this book Enough. We have enough, and I've had enough. And, let's just talk about it. Let's get out there.
Thank you so much, Dr. Eckert. I think that's absolutely right. We are out of time for today. I want to quickly say thank you to each of the panelists for your time and your stories and sharing with us. We also have two questions that I want to get to. Number one, that Rotary International and the polio campaign of Rotary is absolutely something that we think about, and we are connected to Rotary at many different levels. I would encourage each of you to think about how Rotary and civic organizations can work in your communities around this. And also a note around the HPV vaccination, which can be recommended up to age 46, I believe, depending on conversations with your doctor. Okay, with that, I want to say thank you to everyone on the line today.
Thank you.
Thank you.
Thank you. Gracias.
Thank you so much.
Thank you.
Okay, goodbye, everyone. See you next time.
Bye.